Hello, friends. Today we will be discussing cardiac impulse generation and its conduction into the heart. You know, cardiac impulse formation occurs in the SA node, a node which is situated in the right atrium on its upper part at the entry of superior vena cava. Now, once the impulse forms from this place, it goes to the right atrium toward the lower side and also spreads toward the left atrium. Now, once it touches the left atrium, it spreads across the entire part, and in the lower part of the right atrium, there is a structure which is called the AV node. Now, this is the node which has got the electrical connection between the atrium and the ventricle. Otherwise, the entire annulus between the atria and the ventricle is impervious to electrical impulse. So, no impulse can transmit from the atrium to the ventricle. It doesn't occur. Its only place is through the AV node. And after the AV node, it goes into the bundle of His. So this is the structure which is the electrical connection between the AV node and its branches. The the bundle of His divides into left bundle branch and the right bundle branch. The right bundle branch goes right up to the apex of the right ventricle and then spreads upward and divides into various Purkinje fibers, which are shown in the yellow color. Whereas on the left side, the left bundle divides first into the septal branch and then divides into the anterior fascicle, the one going up on the anterior side, and the left posterior fascicle, which goes to the apex and then gets transmitted up. And these are ending into the Purkinje fibers, which supply the fibers to the heart on the left side. Now, this right bundle branch and the left bundle branch originate from the bundle of His, and right bundle goes to the apex and then turns upward, whereas left divides into three parts, that is septal fascicle, anterior fascicle, and the fibula. Now, these things are important because these are reflected in the ECG, because the conduction of the impulse from the septal branch is from left ventricle to the right ventricular side. So this is important because which is seen in the form of U wave in the lead 1 and AVL or V5 V6. Once impulse starts from the SA node and reaches the AV node, after that there is a delay in the impulse transmission to bundle of His. This is called AV delay, which is seen in the form of PR interval. Now, this PR interval, which is starting from the P wave to the onset of QRS, that is between these 2 points, the P onset and the QRS onset, this is called the PR interval. Now, 80% of this is contributed by AV delay. AV delay at this point. Now, once the impulse crosses the AV node, then the path is very fast. So this his bundle and its branches, they are very fast in transmitting. They got the electrical wires which transmit it very fast, and this contributes to just 20% of AV delay. AV delay. Now, why this delay is there? Why delay? That the YPR interval is there. The reason for this is that as the atria are emptying their contents both on the right and the left side, it needs time for the ventricle to fill up and start its own impulse. So if the whole thing is simultaneous, then there would be hardly any cardiac output. So this has got a very important meaning of this delay, is that the filling of the ventricle occurs during this period. Now, to sum up, cardiac impulse starts from SA node, goes to the atrium, first on the right side and then to the left side. Then it goes down into the right atrium to depolarize the AV node. From here, impulse goes to the bundle of His, and then its bundle branches. That is the left and the right bundle branch. The RBB, right bundle branch, goes to the RV apex and then turns upward to give Purkinje fibers to the right ventricle. The left bundle branch gives first branch, that is the septal branch, and then divides into anterior fascicle and left posterior fascicle, which goes up the posterior part of the left ventricle and then stimulates the left ventricle. The SA node activation does not produce any reflection in the ECG. So there is no point from where you can judge that SA node has activated. But when it stimulates the atria, that's the atrial activation, that is marked by the presence of P wave. Now the first part of the P wave is contributed by activation of the right atrium, and the second part of the P wave is formed by the activation of the left atrium. Now the activation of the AV node to the activation of the ventricle, that's from this place to the ventricles, is reflected by the PR segment, and the septal activation is reflected by the presence of Q wave, which is the negative deflection, and the QRS complex. The QRS reflects the sum of activation of both the ventricles. So, if you see, the activation of some parts are reflected by waves and the other parts are not reflected by any waves but only the isoelectric segments.